That's okay.
Good morning,
Thank
dear colleagues. We are here today for this webinar about the human element, and this is part of WIPI3. It is a collaboration between University of Thessaly and University of Gothenburg. We try to answer the question, why is important to understand human behavior? We aim to implement a successful intervention in the prevention of infectious diseases on board, and for this reason we need allies. And who these allies would be? All those who work in the cruise chain. To name a few, we have crew members, we have passengers, we have the management of cruise industry, we have authorities, we have other shipping companies, just to name a few. And this survey was made in cooperation with the cruise companies that participate in the project. They actively provided resources, including their time, arranged for cruise and passengers for focus groups and cruise and passenger surveys. They shared with us their own questionnaires to avoid duplication, and they gave us fruitful comments in the final version of the questionnaires. They also facilitated the dissemination of the survey among passengers and crews. Now, without further ado, I will invite Lemonia Anagnostopoulos to present the results of our research. Lemonia is a PhD candidate in the University of Thessaly, and she's a brilliant young scientist who has been working tirelessly in the realization of this project, and especially in this task. Lemonia, you have the floor. And with regards to questions, I would suggest to take the questions at the end of the presentation. So, Lemonia, the floor is yours.
Thank you, Dr. Andreotti. First off, can everyone see my screen in full screen mode?
Yes, okay.
Yes, okay. Thank you. So today, as Dr. Andreotti said, we're going to present the development and results of this healthy sailing study that was conducted jointly by both the University of Gothenburg and the University of Thessaly. So I'll just say that in this webinar, we're presenting data that's been collected and analyzed up until November 2023 and submitted as part of the project's foundation report. And as you'll see later on, we're actually continuing to collect data for this study. So why did we want to consider behavioral and cultural aspects affecting disease spread? Well, there's a number of different measures that are reported in the literature and in guidelines to prevent and manage infectious disease outbreaks on board passenger ships. And so here on the left, you can see some of these different types of measures. But I think one thing that they all have in common is that they all have a behavioral component to them. And what I mean by that is that the implementation of these measures, it really depends on individual human behavior. And so this can be kind of considered a limitation of these types of measures because they're really only as effective as how well they're applied by cruise travelers. So for example, measures like pre-embarkation screening or syndromic surveillance, in order for them to work, it relies on crew and passengers to honestly and immediately report their symptoms. For a measure like isolation to be effective, it depends on travelers practicing isolation strictly for the entire duration. So I think it's important to try and understand what determines passenger and crew behavior. And one reason is that it's so we can contribute to the scientific evidence base. We saw through another systematic review that was conducted by Healthy Sailing that behavioral risk factors, specifically for norovirus on cruise ships, they're not really that well examined in the literature. So I think this would be valuable to add to the evidence for behavioral risk factors. But I think a second reason to try and understand traveler behavior is to try and improve prevention measures and intervention strategies. And so as part of this study, we conducted a knowledge, attitudes, and practices survey, or CAP survey, among cruise ship crew and passengers, because we wanted to try and understand their knowledge about infectious diseases, their perceptions or their attitudes about different prevention and control measures on board. And also we wanted to understand how travelers complied with these different measures. And then to try and understand and get an even better understanding about what basically helps and what can stop passengers and crew from complying with these measures, we also decided to conduct focus groups with crew members of different cruise ships. So when we were developing the CAP surveys, we considered practices for infectious diseases in general, but we also wanted to include, for example, some questions about transmission that was focused on gastroenteritis, influenza, and COVID-19, because these are infections that are more commonly reported on cruises. And then, so as Dr. Andriotti mentioned, the CAP surveys, they were peer reviewed. So we got input and feedback from both the Healthy Sailing epidemiological team and the social sciences team. But we also got the surveys, they were reviewed, and input was received from all the different cruise lines that were participating in the consortium as well. So we ended up pre-testing the first version of the surveys with native and non-native English speakers here at the universities because we wanted to try and take into account the different, I guess, language profiles of the travelers that would be completing the surveys. And then from the results of the pretest, we actually prepared a second version of the surveys, which we then pilot tested with 10 crew members and 6 passengers on board one cruise voyage. And so the main purpose of this pilot test was to try and get feedback on the clarity of the questions we included. And then after the pilot test, we developed the finalized versions of both questionnaires. And we ended up disseminating the cruise survey to 2 cruise lines between October and November of 2023. And then for the passenger survey, in order to engage as many passengers as possible, 2 healthy sailing researchers actually boarded a cruise voyage in November 2023 to get passengers to complete the survey. So for the questionnaires themselves, we tried to make them as concise as possible while we were still collecting valuable information. And so we included knowledge questions about everything from infectious disease causes to transmission and prevention. We had questions on attitudes and perceptions about different prevention and control measures and compliance with measures. So things like hand washing and face mask wearing and isolation. And then we also had a section for practice questions where we basically asked travelers what they did if they experienced symptoms on board and how often they practiced certain prevention and control measures. We also collected demographic information from crew and passengers. So, for example, for crew members, we collected information on their work department and their years of experience. And then for crew members, we also included some questions about what type of training that they would prefer. So, what type of public health training that they would like to participate in as crew members. So there was a variety of different question types. Some could be answered on a 5 level item scale, some were multiple choice and true false, and others were free text. And so the questionnaires, they're actually available on the Healthy Sailing online repository. And this is a database where we store existing data collection tools that the project has made. So they're available for future tasks. Now the repository, it's an internal access repository, so it's only accessible by partners, but you can access the surveys through this QR code if you're interested in seeing them as a partner. So in terms of the analysis for the CAP surveys, we considered 4 factors that examined knowledge. So we looked at knowledge specific to infectious disease prevention. We looked at knowledge specific to transmission, knowledge specific to symptom reporting, and then we looked at overall knowledge as well, which considered all 3 of the knowledge specific factors. We also looked at 3 factors that examined compliance with measures. So we looked specifically at compliance with isolation, with hand washing, and with symptom reporting. So we basically set the correct response for each question, and then each participant that had a score of more than 80% in a knowledge factor, this was considered good knowledge. And we considered compliance as participants who had a score of 100% with a compliance factor. So we conducted univariable analysis to look at the association between good knowledge, so for each of the 4 knowledge factors, and demographics of the respondents. And then we also looked at good knowledge of each factor with compliance factors. And after this, we also conducted multivariable logistic regression analysis. For each of the four knowledge factors, we had compliance factors as a predictor. So until November of 2023, we had a total of 737 crew members who completed the questionnaire and were included in this analysis. And so this included, I think, around 340 crew members from Cruise Line A and about 390 from Cruise Line B. And so most of the crew members, they were between the ages of 25 and 34, and about three-quarters were men or male. What we saw was that the majority of the crew, so about around 60%, they were born in Southeastern or South Asia, and about 10% were born in Latin America and 5% in North Africa. And the same distribution was seen when we looked at where the crew members currently live. When we looked at their education level, we saw that about one third had some sort of an undergraduate degree, while about 30% had some college experience but no diploma, and another 30% had at least a high school diploma. Most of the participants by far worked in the food and beverage department on board their cruise ship, and about a quarter worked in housekeeping departments. We had fewer crew respondents from the deck, engineering, and medical departments. And when we looked at their years of experience on board, we saw that about 60% of the crew respondents had at least 5 or more years of experience working specifically on cruise ships. So when we looked at crew responses to knowledge questions, we saw that about 95% had correctly answered knowledge questions about infectious disease prevention, but we saw that only 24% correctly answered questions about disease transmission, and even less, so about 8%, correctly answered knowledge questions about symptom reporting. And so one thing that we found really interesting was that when we asked crew members, why do people become infected with illnesses like gastroenteritis or COVID or flu? Almost all respondents, so 95%, 96%, they correctly answered that microorganisms like bacteria and viruses, they're the cause for infections. But we also saw that 80% of crew respondents considered air pollution as a cause of these infections. We saw 74% considered insecticides as a cause. And then we also saw that 47% of the crew respondents considered vaccines as the cause of these types of illness. Now, when we asked crew about which infectious diseases should be reported, for symptoms like diarrhea and vomiting and fever, we saw between 80 to 85% of respondents agree that these symptoms should be reported, but we saw that only about 50% of crew respondents agreed that skin rash and abdominal cramps, those types of symptoms, should be reported. We also saw that nearly all respondents, so about 99%, they said that if they were to experience symptoms of infectious disease on board, they'd report it to their supervisor or the medical staff immediately. And some of the main reasons they listed for reporting their symptoms was that it would help protect other people on board and stop the spread of disease. Reporting symptoms would help them receive the appropriate medical care. And they also considered it as their responsibility as a seafarer to report symptoms. But one interesting thing that we also saw was that of crew members that reported experiencing symptoms of diarrhea or vomiting or fever while working on board in the past, almost 60% said that they reported their symptoms with about a 1 day delay, so they didn't report them immediately. So when we looked at crew responses to compliance questions, we saw that nearly all respondents correctly answered questions about compliance with isolation measures and symptom reporting. But we saw that only 53% of crew respondents correctly answered questions about compliance with hand washing measures. And when we asked crew about what are the reasons for hand washing or washing your hands with soap and water, the majority, so almost all of them, they considered hand washing as useful to avoid getting sick on board and useful for eliminating pathogens. And about 90% considered it important as a way to set an example for passengers or because it was just a requirement of their job. But we also saw that quite a significant proportion, so about 40%, considered that there's no important reason for hand washing. And I think this proportion of 40% is quite high, considering a lot of the previous responses. And so I'm not sure if this proportion is exactly valid. This was a question where respondents, they could answer on a scale from strongly agree to strongly disagree about reasons for hand washing. So I don't know if there's maybe a subset of crew that were trying to complete the questionnaire quickly and we're just kind of scrolling through and agreeing with all the options as they were completing it. But again, when we look at compliance, we see that only 62% of crew reported that they wash their hands for more than 20 seconds, which is the recommended time by WHO. The remainder of the participants reported washing their hands for either 10 to 20 seconds or they didn't know how long they washed their hands for. So we don't have time to present all the results, but in univariable analysis, we saw that factors like older age, having 5 or more years of experience working on cruise ships, and compliance with measures like symptom reporting, hand washing, and isolation, these were all factors that had a positive association with good overall knowledge about infectious diseases. And we saw that factors negatively associated with overall good knowledge in univariable analysis included crew members having a lower education level and working in certain departments. In this case, passenger services, which was considered the administration and reception desks, security members, shore excursion staff. In multivariable analysis, we saw that compliance with isolation and having 5 or more years of experience had a positive association with knowledge specific to transmission of infectious diseases. But when we looked specifically at prevention, we saw that good knowledge about infectious disease prevention, it wasn't a statistically significant predictor of crew compliance with any of the measures. So now looking at the passenger survey, until November 2023, we had 81 passengers complete the questionnaire who were included in the analysis. The majority of passenger respondents, they were between the ages of 55 and 79, and about 64% were male. We saw that about 40% of the passengers, they lived in North America, and the other 20% lived in Southern Europe. And we saw again the same distribution when we looked at where these passengers were born. Most of the passengers, they had a higher level degree, so they either had a postgraduate or an undergraduate degree. And when we looked at their cruise experiences, we saw that only about 12% of the passengers, they had been on 5 or more cruises in the last 5 years. And we also saw that most of the passengers, they were traveling either with family or with a travel group. So when we looked at passenger responses to knowledge questions, we saw that about 94%, they correctly answered questions specific about infectious disease prevention. But we saw actually a much lower proportion, only 17% and 7%, that correctly answered knowledge questions that were specific to transmission of infectious diseases and symptom reporting. And we also saw that only about 60 to 65% of passengers correctly answered questions about compliance with isolation measures and symptom reporting, which is much lower actually than the crew responses we saw before. When we looked at hand washing specifically, we saw that only 44% of passengers in the survey reported washing their hands for the WHO recommended duration of more than 20 seconds with soap and water. We were also interested in looking at passengers' pre-travel behavior. And we found that only about 10% of the passengers that were surveyed said that they got any sort of advice before their cruise voyage for health issues, whether it was for vaccination or the measures that were implemented. But we found that of these passengers who did seek advice, about 40% actually reported that they went to the cruise company website looking for this type of information. So when we look specifically at symptom reporting, we saw that about 75% of the passengers said that if they were to experience symptoms of diarrhea or vomiting or fever on board, they would report it to the medical staff. And when we asked about which infectious disease symptoms they would report, about 60% said they would report fever or vomiting, but we saw that less than 50% of passengers would report symptoms like diarrhea or skin rash. We also asked why passengers would not report symptoms, and some of the reasons that they said was that they would consider the illness mild and they could take care of it themselves, so they wouldn't report. They thought that isolation might impact their vacation, and passengers also reported that financial fees at the medical facility could maybe deter them from reporting their symptoms. And from the survey, we actually saw that there was two passengers who experienced symptoms of either diarrhea or vomiting or fever while they were on board. One passenger developed symptoms 2 to 3 days before boarding, and the other developed symptoms while on board. But interestingly, we saw that neither of the passengers reported their symptoms to the medical facility or the medical facility staff on the voyage. And when they were asked for the reasons why they didn't report, both passengers, they said that they considered the illness was mild, so they didn't need to go to the facility. They said that they only trusted their own doctor and they didn't go to the facility, and that they considered that people, so their travel companions, might be upset with them if they were actually infected with a disease. One passenger also reported that isolating it would interrupt their vacation and that reporting symptoms would take too much time and they didn't know actually where to report the symptoms. So we also saw in the survey that of the survey respondents, only 34% of passengers said that they were informed in some way by the cruise company. So, for example, through a leaflet or through a TV spot in their cabin about how symptoms should be reported while they're on the voyage. So we also saw through the survey that passengers, they seem to be more willing to comply with prevention and control measures that are, let's say, less intrusive or invasive. So we saw, for example, that 85% of passengers, they'd be willing to wear a face mask in public if the medical facility staff asked them, compared to only 60% of passengers who said they'd be willing to isolate individually for 1 or 2 days during the voyage. Um, Now, in univariable analysis in the passenger survey, we saw that things like higher education level, so having an undergraduate or a postgraduate degree, this was positively associated with good knowledge about infectious disease prevention. But in multivariable analysis, we saw that neither compliance with measures or having a greater number of cruise voyages, so having more cruising experience, was associated with good knowledge about prevention or transmission of infectious diseases. So, with the surveys, we also conducted focus groups to try and understand even more what helps and what maybe stops passengers and crew from complying with measures. And so we thought that focus groups, they'd be a good approach to help us get a more wide range of experiences and opinions from crew members. And so we worked with cruise lines to help us identify crew that would be available to participate in the groups. And we really wanted to make sure that each group had crew that were in the same department and in the same rank so that crew could share their experiences and be more comfortable speaking freely. And so we asked the cruise lines to help us prepare groups from the housekeeping and food and beverage departments so that we could focus on symptom measures, compliance with measures. And then we also asked the cruise lines to help us develop groups from the medical department or other higher ranking officers so we could focus a little bit on outbreak management. So in October of 2023, we actually conducted seven focus groups on board of two cruise lines in Greece. And so we held three focus groups in Cruise Line A. So we talked to crew that worked in food and beverage departments, we talked to crew in housekeeping, and then we also talked to one group which was made up of the deck and engine department. So I think we had in that group the chief engineer, the chief doctor, the staff captain, and I think the hotel manager as well. And then the next day we had 4 focus groups that we held on Cruise Line B. So again, we talked to crew from food and beverage, from entertainment departments, from housekeeping, and from medical personnel. So each focus group discussion, it was audio recorded. And then immediately after the discussion, the 3 facilitators would have a really small debrief where we'd kind of write down and discuss our initial thoughts. And then the complete discussions, they were transcribed and we used thematic content analysis to analyze the data. So essentially the data were they were categorized based on common patterns or concepts that came out of the discussions and the transcripts that we had. So, one of the more, or I guess, the most common concepts that came out of the focus group discussions was non-compliance of passengers during cruise voyages. And during discussions, we had a lot of crew in the different groups describe examples of passengers not complying with measures, especially during COVID or GI outbreaks. So this included things like passengers refusing to wash their hands in buffet areas, to finding people that were supposed to be in isolation wandering around outside the cabin. And so the reasons we discussed for noncompliance in passengers, they were organized into 4 subcategories that you can see here. Participants in both cruise lines, they reported a lack of awareness as a reason for noncompliance, where they said passengers maybe just aren't aware that their actions can cause disease spread. And so one participant, they actually described watching a passenger put their cabin key card in their mouth so that they would have their hands free to then sanitize their hands. There was also a general view among the crew members that even if passengers, though, are aware about disease transmission and spread, if it's not part of the passenger's culture to practice measures like hand washing at home, they won't do it on board. Um, and another thing that the crew members also stated many times was that passengers, they don't comply because cruise lines don't necessarily have the option to implement strict measures on passengers. So there's really no consequences if passengers don't comply with measures. But I think the most common view shared by the participants in all groups, in both cruise lines, was that passengers, they don't necessarily follow measures because they're in something called a vacation mode, which means the passengers, they don't necessarily pay attention or they ignore instructions because they're on their cruise and they want to enjoy their holiday and they don't necessarily want to be bothered with these types of measures. So crew members, they also talked a lot about barriers to symptom reporting for passengers. And these barriers, they fell into 2 main categories, I'd say. The first barrier is that passengers, they might not report their symptoms because of the high costs that are associated with receiving medical services on board, or even the high perceived costs. So maybe even if certain services, say for infectious disease, they're offered free of charge at the ship medical facility, passengers might not know this, and so this could prevent them from reporting. And this focus group finding, it was confirmed. It confirmed basically what was reported by participants in the CAP passenger survey. And I think in the survey, about 45% of passengers, they said that the costs of receiving services would be a deterrent to reporting symptoms. So another barrier that was reported by crew members regarding the passengers was that over the last years, especially with COVID, passengers, they've become aware that uh, reporting symptoms, it could lead to isolation on board during their holiday. And so passengers either avoid reporting symptoms altogether or they delay reporting their symptoms to the end of the cruise so that they don't miss their vacation in isolation. Reasons now for non-compliance among crew that came up, they were divided into 2 categories. And so there was the human factor, and this is where participants in most groups said that compliance with measures, it's really just person dependent. And so some people will follow health measures and others simply just won't. And so this is something that they said likely requires a change in people's behavior and a change in people's mentality and attitudes. And then there was also process factors where crew, they reported that in some cases, maybe there aren't enough human resources available or there's not enough time to properly implement measures like cleaning and disinfection or hand washing. And so it was interesting, though, that participants in several groups of both cruise lines, they said that crew generally are more compliant with measures compared to passengers because crew members, they consider it, first of all, their duty or their responsibility, I guess, to implement measures and to show a good example for both passengers and other crew members on board. But several crew members, they also told us that they're more compliant than passengers because they're not allowed to get sick or they can't get sick because the ship is their home. And so they want to avoid the spread of disease at all costs. So the barriers to symptom reporting by crew, they were categorized based on different practices that are on board. So there were certain groups of participants that had contracts with third-party agencies, and these crew, they reported that the practices of these third-party agencies was that if they were, say, isolated in their cabin ill for a certain number of days, these crew members, they could be relieved from duty, so essentially sent home, or it was possible that their salary could be reduced. And so this is one likely block to crew members reporting their symptoms to the ship doctor on board. Um, and then another barrier that was considered was that crew members reported having limited access to the ship medical doctor. And so they described to us that there's a limited window of time each day that the medical facility was open for them. And so this made it difficult for them to visit the ship doctor and report symptoms if they were on duty. And there was also certain hours where passengers were maybe given priority to be seen by the doctor instead of crew. So I think that both the CAP surveys and the focus groups, they produced a lot of useful findings for healthy sailing. And I think some of the main tasks where the findings they'll be used and actually are already being used is to develop the project's training materials and the guidelines and to inform some of the intervention studies. And so we'll look at some of these in the next slides. But I just want to quickly mention about some gaps in training that we found through this task. So when we were conducting the focus groups, we found that both cruise lines, they said that the responsibility for managing infectious disease outbreaks, it mainly falls on one department, so either the medical department or the housekeeping department, but crew thought that it should be really a shared effort with coordination and collaboration between the different departments to manage an outbreak. And we also saw as a possible gap in training where medical personnel, they said that specialized training for outbreak management that considers the specific environment of a ship could be really useful to them because outbreak management on a ship, it's different than what they had experienced previously in land-based facilities. And so I think moving forward, we consider it important to have training, both for the medical personnel specifically about outbreak management in the ship environment setting, but also to have training for all departments, specifically about the coordination aspects of outbreak management, so that all departments are at the same level or on the same page. And one of the other things that came out of the CAP surveys and the focus groups was that participants, they prefer a participatory approach to training. And so I think this is something that's going to be considered or is being considered in the training tasks of the project. And so from the CAP surveys, we saw that knowledge about prevention measures, it's high for both crew members and passengers, but this didn't necessarily translate into a predictor for compliance with these measures. And so I think we recommend that training is focused not only on which preventive measures should be implemented, but also on having trainees understand the importance of these measures and why they should be implemented. One of our findings that we saw surprisingly was that nearly half of crew they reported vaccines as a reason for becoming sick with infectious diseases. And so I think this signals that there's maybe a gap in crew knowledge about transmission of infectious diseases. So I think it would be important to focus on improving understanding of agents of infectious diseases, but also addressing misinformation about vaccination, because this type of misinformation, it can impact, let's say, vaccination confidence and vaccine rates. And we also saw that passengers, they're less willing to comply with measures like isolation during their voyage that are more invasive. So I think we need to focus on developing strategies to improve passengers not only understanding about the importance of isolation, but also strategies to improve their compliance. Um, when we looked specifically at hand washing, we saw that about a third of crew and half of passengers reported that they washed their hands for less than the WHO's recommended duration. And so we consider it important to have training for crew and risk communication for passengers to understand how hand washing prevents infectious disease, but also how to perform proper hand hygiene. So, using the appropriate technique and duration. But I think here, training alone probably isn't enough because we saw that most crew they had good knowledge about hand washing as a prevention measure, and most passengers agreed that hand washing is important for preventing disease spread on board. So I think here we can look at two or consider two additional things. The first, I think, is that it's important to try and identify possible barriers that crew especially face for hand washing. So maybe things like they have limited access to hand hygiene supplies during their duties, or maybe they have a really heavy workload and so they don't have enough time to, say, wash their hands while they're cleaning cabins. So that's one kind of aspect to look at. But I think in addition to these more organizational barriers, I think it's I think we also need to change the behaviors of crew and passengers. And I know that's something that the partners from USN in Norway worked on and also recently presented during a webinar. One of our findings that we saw as a little bit problematic or as a potentially problematic area was symptom reporting. We saw that knowledge specific to symptom reporting, it was lower compared to other topics for both crew and passengers. We saw that recognizing which symptoms to report varies. We saw that of crew members who had experienced symptoms, 60% had delayed reporting symptoms by about 1 day. We saw passengers on board who didn't report their symptoms. And we know from previous studies that delaying the reporting of gastrointestinal symptoms, it increases the risk of an outbreak on board. And so I think all of these things together that we found, they highlight that it's really important that training and risk communication focus on informing crew and passengers. First of all, what are the different types of infectious disease symptoms that can occur? And which symptoms should be reported, and also focusing on having crew and passengers understanding the reasons for reporting symptoms and what could happen if symptoms aren't reported or if there's delays in reporting. And I think this is especially true for passengers. It should be prioritized to inform them both before they embark, but during the voyage as well, which symptoms should be reported, where they should report them, and how they should report them. Um, Now, in the focus groups, crew members, they discuss some possible strategies for how to improve compliance with measures. And a strategy that was suggested by two different groups actually was offering isolated passengers, say, a discounted future cruise. Now, most of the crew members didn't agree because they thought that passengers would probably take advantage of this and falsely report symptoms. But a strategy that was considered somewhat effective by the crew members was to try and make the isolation period on board for passengers and crew as comfortable as possible. So they said providing things like free internet access, games, free meal options off the a la carte menu was something they considered as somewhat effective. We also saw that different groups in both companies, they agreed that the governmental authorities could have a role to play to improve passenger compliance specifically. And so they considered that the governmental authorities, they could assist with risk communication to passengers for outbreak prevention so that the responsibility of enforcing the measures isn't just on the cruise line themselves, but they kind of the message coming from the governmental authorities could maybe strengthen it. So, crew also talked about finding ways to improve access to the medical facilities for crew and passengers. And another strategy that was identified by participants actually in both cruise lines was to make sure that training for crew and risk communication for passengers had them reflect on the consequences of not complying with measures. So, in other words, the crew members thought it would be really important to try and link that the action of not practicing a measure could lead to consequences like becoming ill or outbreaks on board. And so I think that this last point, it's part of changing people's mentality that was mentioned several times during the focus groups. And so it could be considered to use behavior change models as a framework to try and develop behavior change interventions. And so there's a lot of different models that exist. Um, this is just one model. It's called the COMBI model, and it gives us a framework for how behavior can maybe be changed. And it says that changing behavior, it requires capability, motivation, and opportunity. And so in our case, this means that travelers, they would have to be aware of a specific issue. So for example, they'd have to be aware that outbreaks can occur during a cruise, and they'd also have to recognize that there's a specific behavior that needs to be changed. So for example, in this case, reporting symptoms of infectious disease to the medical facility. But also as part of the capability piece, travelers, they need to feel that they have the skills to actually implement the behavior. So they need to know, for example, where and how to report symptoms. But to change behavior, the model says that motivation is also needed. And so travelers need to feel that doing the behavior will benefit them in some way. So it'll either prevent illness, say, in themselves or in their fellow travelers or fellow crew members. And then also, as part of this model, it says that changing behavior also requires opportunity. So I think in this case, it means, in our case, that processes need to be in place so that um, the behavior can be done. So, for example, making more accessible medical facility hours for crew to report symptoms. So that's just one example of a behavioral change model. And so looking forward now, the sample size that we had for CAP crew and passenger surveys when we analyzed the data, it was a lot less than what we had planned and wanted. And this might impact the generalizability of our findings. And part of the reason for this was we had a really short time between when we developed the surveys and when we submitted the foundation report. So we didn't have a lot of time to collect and analyze the data for this. And it was also really challenging for us to engage specifically the passengers to complete the survey. And so after we submitted the foundation report, we continued collecting data for the CAP crew survey and we collected data from both Cruise Line A and Cruise Line B, but we also then added a third cruise line that we collected data from. And so I think to date, we've reached a sample size of about 1,300 crew members. So we're going to be analyzing the data again to see if this has an impact on our findings for crew members. And then we're also continuing to collect CAP passenger surveys. So over the summer, we had a team from the University of Thessaly that would actually travel to port terminals in Greece to try and collect data from passengers while they were waiting to embark. But again, we found it really hard to collect data this way. So this week, actually yesterday, we had two members from Healthy Sailing board a cruise voyage of Cruise Line A, and so they'll be working this week to collect more passenger surveys. And then we developed a similar CAP survey for ferry crew and passengers. And so this survey, it's been reviewed by the ferry line, and we're hoping to implement the surveys in the next months there. And so there is some work left ahead for us for this study.